All right, so today is 2/1/2021, approximately 20:55 hours. We have Mr. Monkey here helping us. Bradley is no longer interested. So we're rolling up onto a scene with just a single patient, no bystanders, so no sample history really. We have no need for any additional resources at this time. It is dark, cool, and snowing out right now. Because there's no bystanders, like I said, there's no sample history either. Other than that, the scene does appear to be safe. Just one unconscious male, probably in his late 50s, with some severe trauma to his right side of his body. Going to look further into that in a minute. Other than that, the other EMTs and I, we all have our BSI on. And with that, we're going to go perform our assessments. All right. So, because he is a trauma patient, I'm going to have one of the EMTs come over, obtain some C-spine on him. And while he does that, I'm going to get a general impression of anything I noticed right off the bat. So he appears to have some trauma to the right chest, abdomen, and the upper right leg. Some bleeding on that upper right leg. So right away, I'm going to have that bleeding managed by one of the EMTs while the other one's doing C-spine. Now I'm going to check for his level of consciousness. But are you okay? Sir, can you hear me? He's not responsive to verbal. He did wince when applying pain, so he is responsive to pain. So with that, I'm going to just perform ABCs and then general blood sweep overall. Checking his airway with modified jaw thrust. It is open and patent at the moment. Trachea appears to be intact. So with that, we're going to check the breathing sounds next. So I'm going to look, listen, and feel right next to his mouth, expose that chest, and ensure that the chest has equal rise and fall. So with that, I'm going to check that right now.
His breathing is pretty quick, but it is shallow. So we're going to have one of the other EMTs bag him at the moment. Now we're going to check his circulation. He has a capillary refill. We'll check his pulse for 30 seconds to get his pulse, and it is pretty rapid and weak. We'll estimate 120 beats per minute. We're going to check his skin color, temperature, and appearance. He is pretty pale, he's cool, and he's moist. So now that we've checked his ABCs, we're going to just listen to his lungs briefly, check his eyes responsiveness or pupil responsiveness, and then we're going to determine what we're going to do with him. Alright, so his breathing is, his lung signs are pretty weak. His eyes are unresponsive to light, but they are equal in size, which is good. So now we're going to do a quick blood sweep. At this time, we've determined, because he is a trauma patient, he has some severe trauma, that we're going to transport him to the local trauma center and hopefully meet some EMTs halfway. So we're going to make all those notifications as necessary, and we're going to begin with our blood sweep now. While I'm doing the blood sweep, I'm going to send an EMT over to get the cervical collar and the backboard. And while that happens, I'm going to begin. So I'm going to check his scalp for any blood or anything, any major injuries that we notice off the bat. Find the ears for battle signs. Checking the neck. There's nothing at the moment. Checking the left chest. There's no blood or anything. Checking his abdomen and quadrants. There's no blood. We'll go around and check his back and work our way down to the pelvis. There's no blood. There's no injuries to the genital region. Next, we're going to check his legs. No blood on the left leg. There was some blood on the upper right leg. So we're going to have that managed by one of the other EMTs. I'm going to check for the distal pulses. This one is strong, or I shouldn't say strong, but weak, but it's still there. It's present. The one on the right side, though, is not present, so hopefully managing that's going to take care of that. With that, they've applied the cervical collar. Now we're going to roll him up on 3 and then roll him back onto the backboard. Just going to check the back of the body. Alright, on the count of 3. 1, 2, 3. Just once again checking any blood. There is none. So now we're going to roll him back on 3. So ready? 1, 2, 3. Alright, so now he's all prepped and packaged for transport. The hospital's been notified. We've completed our initial assessment. So now we're going to transport him back to the back of the bus and do a secondary assessment, look for any further injuries that we have not noticed the first time around. So, beginning with the head. Nothing on the scalp. There's no CSF or battle signs behind the ears. I'm going to check his neck. No step-offs or anything. Neck appears to be intact. I'm going to check the front of his head, check the orbitals. They appear to be intact. Nasal bone, maxilla, and the mandible. Those are all intact. We're going to work our way down to the shoulders, moving one at a time and then together. Nothing wrong with the shoulders. I'm going to check the scapulas. The right one does have a deformity on it, so we are going to note that and alert the trauma team when we see them. We're going to now work our way to the chest. We're going to avoid the right side of the chest because there's obviously deformities there that we have noted earlier. So checking the left side. The chest is intact. Chest wall is strong. Checking the sternum. Appears to be intact still. That trachea is still good. Going to work our way to the abdomen. Checking in quadrants. The left side is good. The right side does appear to be swollen and tender, so I'm going to avoid touching that for now. I'm going to lightly palpate it maybe. Going to check the back. Back is in good condition. Going to check the pelvis by pushing in but not up or down to avoid further injury. Pelvis is okay. There are no general injuries like we said earlier. Going to check the left leg. Left leg is intact. Distal pulse is still there. Going to check the right leg. That it's been managed and the distal pulse is back. It's still fairly weak, just like the rest of them, but it's there now, which is good. It's present. So now we have completed the whole assessment, secondary assessment, I should say, and we're going to go over our basic vital signs with him. So we're going to check our pulse, make sure it's still there. Forgot to check the arms. Checking the arms, and then we're going to do the vital signs. The arms are intact. He has a pulse on both sides. So now we're going to check the vital signs. Going to check those lung sounds. The lung sounds are improving, I should say. And check the pupils. Those have not changed. They are still unresponsive to light, but they are still equal in size, so at least they haven't gotten worse. We checked the pulse, pupils, the lung sounds. We would check a BP if we had a cuff small enough. Possibly check O2 sats. Other than that, we're going to check the capillary refill again. And now that we have everything noted that we need to know for now, we're going to just reassess every 5 minutes the vital signs because he is a trauma patient, and we're going to transfer care when possible. Thank you.